Hello and welcome to CIO News. I am Soni, host of the broadcast and chief editor at CIO News. This is our exclusive interview series powered by Goto. It is a recorded session and will be available on our website at cionews.co.in and our CIO News LinkedIn handle. It is my pleasure to invite our guest for today. We have Dr. Naresh Yallapragada. He is the Group Chief Information Officer from Rainbow Children's Hospital. Dr. Naresh is a healthcare IT leader with 20 plus years of experience in delivering IT projects to healthcare institutions under different categories. He has been into product development, consulting, and IT implementation in India and in the US. Dr. Naresh has widely traveled with good knowledge on the healthcare industries around the world, trained in health informatics in the UK through a full-time master's program. He's acquired the basics of management through an executive management program from IIM Calcutta. He's the current treasurer for the Hyderabad chapter of the CIO Club. And Dr. Naresh is proficient in the change management and devising ways to get a buy-in of the end users and compromising of doctors and administrative staff. Sir, it is an absolute pleasure to have you today, and we're really looking forward to great discussion with you.
Thanks, Khushbu. Thanks for the opportunity. Great to be here.
Awesome. We're also accompanied by Triveni Rabindraraj. She is the India sales head from Goto. And Triveni has 2 decades of experience working for various brands such as Wipro, City, Dun& Bradstreet, and many more. Triveni, great to have you back.
Thank you.
Awesome. So I wanted to begin, with you, Dr. Naresh. We've realized that hospital, the healthcare institute has been been understood to be the major industry in the last and very critical industry for all of us in the last couple of years, right? And that also says that there was a very heavy load on the IT team to make sure the employees and the working of the staff was there in these last 2 3 years. So, given these demands of the changing world and the today's distributed workforce, what is your current working environment? If you can give us an insight. Is it hybrid, work from home? How is your workforce distributed currently?
Well, Khushbu, as you rightly said, we are in a healthcare industry, and being in healthcare delivery space, we've never had the luxury of working from home, right? We are the ones who have to be in the hospital taking care of patients, uh, be it all departments, both patient care areas, front office areas, or back functions like IT, finance, HR, etc. So right throughout the pandemic, I should say that wherever we have worked, everybody was kind of coming to the office place and working. We never had a work from home culture anywhere before, or I don't think we have that kind of an environment, especially in a hospital. That's the way we are. But having said that, thanks to the pandemic, there's been a renewed focus on how best we can use technology in continuing the way we work, right?
Right.
Wherein your remote connectivity has always played a major important role in that space.
Correct.
And I remember that at the peak of the pandemic, some of the people who were back office functions mainly were supposed to work from office. They have
Yeah.
requested of working from home. That's where we thought of can we have an explore an option where people can connect from home. That's where the focus on
Right.
security, the audit controls, etc., had come into the picture. But to summarize, I think being in a hospital industry, I don't think we will ever have the luxury of working from home.
Right. So I'm sure in these times, while there must be an increase in the workforce, there would be asked to increase your help desk support as well. So is your current help desk team grown, and is your help desk solution fully empowered to provide fast and efficient support for the flexible working ways of the employees.
Uh, as I said, the help desk as well as the support teams are spread across every unit of Rainbow. It is not a centralized system where every ticket is answered by somebody sitting in the corporate office, etc. So every unit of ours have people deployed who will be the first line of help for anybody who has a concern as far as the technology is concerned. Then we have an escalation matrix whether that issue is not solved within certain period of time. Then it goes to a cluster level. So for example, Bangalore we've got 3 units, Hyderabad we've got 6 units. So the first ring of defense is the people deployed the unit. Second ring of defense is the cluster. Third is where the corporate office would come into picture.
Right.
So this will ensure one that there is a focus on solving issues whenever people have. Second, we get to know how much is the productivity levels for each of the help desk staff which we have deployed. I think that's the model in which we are working right now.
Got it. Got it. Got it. And as you mentioned that there is a importance of remote support in these times that was required. So my question to you is, Triveni, you've been interacting with CIOs in different verticals. What have been your interactions? How have you seen CIOs prioritizing when considering for remote support solutions?
Yeah, thanks a lot for that question, Khushbu, and great sharing the panel with Mr. Dr. Naresh. Just to give a quick overview, right? So I think, like Dr. Naresh had mentioned, right? Obviously, we all know the critical role that the healthcare industry really played, right? Like they were called the frontline soldiers in this in that situation, right? So I think one of the things that made us, which is not only Goto but our entire industry relevant, was that we were able to step up and help the corporate guys go overnight 100% remote, right? Specifically the non essential industry. And what we also did was, I remember in the COVID time, which we deployed across the industry and specifically for the critical care units and critical care industries. What was that, during the pandemic we deployed and we made all our tools available free of cost for 6 months. We called it the emergency remote work kits for all the corporates, but more essentially the healthcare, the government, the NGOs, those kind of organizations. Right now, given that experience, what we've seen is, like Dr. Naresh said, that we didn't see too many, or we didn't see the healthcare industry sort of use a lot of remote tools. But what really became important is that the doctors adopting the telemedicines, right? And the doctors doing teleconsultation. Our solutions were used for, and I think that is still continuing, right? And our solutions are still used for that purpose. And obviously now people have seen the ease of using it. It becomes easier for the patients also not to sort of it's not imperative for them to walk into the hospitals, but all the doctors are available remotely to help them anytime. It's really like medication anytime anywhere, if I would say that. I think these things became very easily adopted by the industry as such, right? Which wouldn't have possibly been or which would have possibly taken at least another 10 to 12 years for us to reach where we are. I still remember, right, one of my our family doctors, he's almost about 80 now. And but very passionate doctor. And he used to, and not very technology friendly, obviously, right? And but very passionate, and he still practices, right? 3 months, I remember 3 months back, when we called him up and we were like, we'll come to your clinic. He said, no, why do you need to come to my clinic? I'm at home. You can log into, you can log into my virtual meeting platform and we can have a call on that. Absolutely not. And he's someone who is absolutely not technology friendly. And I mean, so that's the kind of adoption that's happened. Now, coming to the remote support tools, right? Some of the use cases, what we have seen is, especially when the equipment's sort of going not working, or especially the medical devices not working. There we have seen a big use case for our remote support tools, where where the technicians, like say a G medical device not working or something, where technicians from that particular organization sort of take control with the hospital's IT team, and help them out with a lot of immediate kind of a fix. And also, I think what where we have seen is, I think we've also, I don't know, Sarbajit, correct me if I'm wrong. I think for Rainbow Hospitals also, we had made some of our tools readily available for them to use during the COVID time. With respect to the remote support tools, where we have seen a big use case is specifically where the hospitals have multi network across the countries, where where they don't have IT folks deployed. One, the second one is, although IT folks are deployed in every hospital, obviously because of the numerous, numerous issues coming up, and that issues or incidents increasing, it becomes important for the technicians to sort of have multi sessions, right? So I think that has again become very prevalent in the industry. The other one is unattended access. Right now, unattended access is something again we saw that was that was used quite a bit from the from this particular industry, because obviously it's not it becomes a little tough when you have, like say, your front desk person's system is not working, and then you have a long queue of customers, right? You can't obviously sit on the system and wait for the technician to sort of finish with the troubleshooting, etc., right? Because the front desk executive is supposed to do whatever admission formality, etc., engage with the with the patients, etc. So then it's not necessary that the person is sitting at the system, right? So that in those scenarios, again, we have seen the unattended access coming into picture. The last point is on security, right? I think because the the healthcare industry as such is bound by so many regulations and compliances, etc., to have secure connections become very very important, right? And obviously they need to look into, is the vendor HIPAA compliant, or SOC 2 SOC 3 compliant, GDPR compliant. That became important. And for CIOs like Dr. Naresh, what is also important is that the technicians should only get access to information which is not confidential, like probably, like the PHI data, right? The personal health information, the PLI data, these things obviously should not be exposed to the technicians, right? So how can you sort of give controls to certain data which is not to be viewed, or don't give control? So these kind of stuff which we saw use a lot by the industry.
Right, absolutely. Thank you, Triveni, for touching on all these important elements. My question to you is, Dr. Naresh, having the tool with the right priorities met is one half of the challenge done, and the other half is, driving enough adoption to meet ROI standards. So, what are your, driving forces when it comes to achieving optimal ROI of the solutions?
Well, as Triveni said, before the pandemic, every CIO had taken a lot of time to get his budgets approved across the technology space. But after the pandemic, at least the good part for a CIO, at least in a hospital, is that budgets are immediately approved, which is a good part. Second piece is doctors and majority of the clinical staff, which are little averse to use technology now. I think they've got the taste of it. They've understood the way the advantages are. So that's the reason they've kind of getting onto the bandwagon of understanding how to use, etc. I'll give you a simple example. Before the pandemic, whenever we used to go train people, especially doctors and nurses, on using the electronic medical record, everybody didn't have the focus, nor the interest, nor the inclination to learn and help us. So every meeting where we were supposed to present the uptake of an IT system in a hospital, some of these were constant challenges. But after this is after COVID. I think now everybody our graphs are all looking nice and full, which is easy. Is one of the input parameters for the management to consider now, because the focus is there now, because the people have understood the way it works. Now they have seen the advantages, so the uptake is quite easy right now, right? And obviously, it also depends on the tool itself, right? If it's an easy to use tool, easy to understandable tool, where the deployment easy for IT management is easy, the company has a credible name in the industry, a good support system, which can help the organization like Rainbow to adopt and use. I'm sure the ROI and the is quite easy for us to achieve.
Right. Absolutely, absolutely. On that, my question to you is, Triveni, there are challenges while adopting remote support solutions, and also even before that. So, how do you suggest CIOs to overcome these challenges on evaluations and adopting of remote support solutions?
Yeah, so I'll hand. So firstly, we have some right before purchase and post purchase, right? I'll touch upon post purchase because that will be like a continuation to what Dr. Naresh touched upon. In the I think in the post evaluation phase, we as OEMs, right? I mean, any technology for that matter. What is important is simplification, right? And especially in the healthcare industry, obviously people are experts in their field, not technology, right? And traditionally that's how it has been. Even the most qualified doctors may not be as technically savvy, right? I mean, obviously today the new age doctors are a slightly different, but primarily that will be the challenge. So we need to ensure that we give them a simplified UI, right? So that is very very important. Even for the technicians, right? A simplified UI any time saves the day. The other thing is that they should be able to use it pretty easily, right? If the usability is complicated, or if the way the like say if the way the technicians sort of ask them to perform certain commands or perform certain things, if that particular stuff is also complicated, the user base will obviously switch off. They will not use it, right? The third bit is and this is something that I'm 100% sure every CIO struggles with, which is change management, right? It's typically, people know to use it, but they love the way things were happening before, or the legacy way of working it, right? So I think that for specifically for that, right? A lot of OEMs like us, we have very robust customer success teams whose core job is to ensure that there is a proper training, proper hand holding. We give user training, we give admin trainings, not only for using it but also for analyzing reports, administering a lot of analysis. How do you measure KPI? Because at the end of the day, Dr. Naresh is responsible for the ROI of it, and he has to present it to his management. So how do you help your customers sort of measure that ROI? So that is something that is extremely important, right? Especially with remote support, more so, because if the KPIs are decided, even before the deployment, then it becomes easy. And also, OEMs sort of going back to them probably quarter on quarter to show how the tool is performing, how many users are actually using, and how many users are not using, because that will help the CIO organization to go back to the users, or to go back and see how else can we sort of further retrade the usage of the tool. These are some things that need to be sort of kept in mind for post implementation. With when it comes to pre implementation, and specifically with remote support tool, right? I think what will be critical in a healthcare kind of a scenario is everything is here and now. and everything is important and urgent, right? So there's no, I think everything comes as a P1 issue. So what becomes very important is that the technicians are equipped to do the diagnostics
Half an
immediately.
hour.
And
Meeting.
sorry. Yeah, so important, important to do the diagnostic irrespective of the device, right? Is it a mobile device? Is it Android, iOS? So that is the first and foremost thing. The second thing is that the other one is that the recurring issues, right? A lot of IT requests that we get today, if we really look at it, 70% are all repetitive. And I'm sure Dr. Naresh, you'll agree with me that most of them are for password reset, right? If you actually look at it. So so can we have can we create a set of FAQ for commonly commonly asked issue or commonly reported issue, so that the workflow becomes pretty easy, and again the time for managing those incidents are sort of saved, right? The other one is to ensure that we sort of have some kind of a mechanism to let's say, for example, if uh, you know uh, employee number one calls up 3 times, right? That particular employee's device need to be recorded, right? The assets, the technicians need to go back and see what was the problem with the asset previously. So having a record of those also is very helpful for reducing the time. So in short, if I say, from a healthcare perspective, a, a remote support tool needs to ensure that two main KPIs, right? One is the average handling time of a particular issue or a ticket, and the first call resolution. These two probably will be very very critical for from a healthcare perspective.
Great. Thanks, Triveni, for sharing your insights. Dr. Naresh, my question to you is if you can share certain best practices as per you that you've been driving and you recommend other CIOs from the support aspects, that would be
Well, one thing is the whole thing on the security piece to it, right?
Right.
Where it makes major important because of all the areas where we are creating a loophole if you don't follow a good practice as well as a remote connectivity is concerned. For that, obviously, our statutory auditors are always there to guide and tell us where we are going right and where we are going wrong. But at least from a policy and implementation perspective, one of the best practices we've adopted and been successful at is having a real time audit of what we are giving and what kind of access are we giving to people, right? First is who's asking for that request, who's asking for that, what is the kind of need which happens, right? Who's approving it, who's giving it, in a regular audit of what is happening as far as the access control is concerned. That was one. Second is having a periodic audit of all these accesses which we've given is one thing. Second, the other important practice which we've kind of adopted is for that there are no generic logins which we create, right? One of the reasons what we have seen is that there are login called guest, there's a login called rainbow, there's a login something else, and we don't know who's the person who's logged in and what is the kind of activities which that person has done by using this access. So we've adopted a policy where there will be no generic logins, it's all person dependent, right? So we have to have a name of the person who's given access to this, so that we have a log of who's doing what, right? That it to a certain extent controlled the way in which happens. Second is what the new initiative what we've taken at the time of join, whenever a new employee joins Rainbow, what we have made it mandatory is that that employee has to sign a declaration form saying that whatever IT assets or whatever remote access which people have to the system, that person is responsible for all the activities and he can be reprimanded whenever we found something untoward happens, right? So the employee has in the back of the mind saying that yes, I've signed this declaration form, so I better not misuse it, right? So these are the three, four improvements which we have done to ensure there is no mishap happening.
awesome. Great. Great conversation with you, Dr. Naresh and Triveni. And with the interest of time, I would like to thank you both for taking out time and joining us on this episode. It was a pleasure to host you both, and I look forward to having many more interactions.
Thank you so
Thanks,
much. Thanks,
thanks,
Shubhani. Thanks, Khushbu. Thanks, everyone.
thanks,
Thank
Dr.
you.
Naresh. Thanks.